Hi friends, welcome to this video on thyroid diseases. Thyroid hormone is essential for metabolism, growth and development, which is secreted by thyroid gland, which is influenced by pituitary and hypothalamus. What is the presentation in case of thyroid illness? Patient may come with swelling in the neck or patient may come with some related or unrelated symptoms according to the status. Hypothyroid or hyperthyroid symptoms, or doctor may suspect the thyroid dysfunction. Based on imaging and morphology, thyroid swellings are classified as diffuse goiter, multinodular goiter, or single nodule or adenoma. Based on hormonal evaluation, based on thyroid functional test, it can be classified as euthyroid status, hyperthyroid, or hypothyroid status. Usually, thyroid swelling is midline swelling in the neck that moves with deglutition and extension to the neck. Auscultation, some cases we may feel bruit, percussion. If it is retrosternal extension is there, dull sound you may get on percussion. Now, diagnostic tests, functional tests, thyroid functional tests include TSH, T3, T4 and thyroid antibody test. TSH normal range is 0.4 to 4 milliunits per liter and T4 0.6 to 1.6 nanogram per deciliter and T3 230 to 619 picogram per deciliter. Thyroid antibody test is usually negative. If TSH is more, T3, T4 is low, it is primary hypothyroidism. If TSH is low and T3, T4 also low, it is secondary hypothyroidism. Positive antibody indicates Hashimoto's disease. Point 4 to 5.5 milli international units per liter is normal, and no further testing is required unless clinically indicated. If it is more than 5.50, hypothyroidism we have to suspect and we have to evaluate anti-TPO antibody and free T4. If it is less than 0.10, hyperthyroidism is suspected and we have to evaluate free T3 and T4. If it is borderline 0.10 to 0.39, we have to evaluate free T4. Subclinical hypothyroidism, TSH range is 5.5 to 10 and overt TSH, overt hypothyroidism TSH is more than 10. What are the symptoms in case of hypo and hyperthyroidism? Hypothyroidism, there is reduced heart rate and there is enlarged goiter and fatigue and sensitivity to cold and dry skin, weight gain, puffiness, constipation and irregular menstrual problems and depression, mood swings, joint and muscle pains and high cholesterol and inability to think clearly. Whereas hyperthyroidism has goiter, heart palpitations, tremors, anxiety, sleep disturbances, heat intolerance, weight loss, hair loss, diarrhea, increased appetite and irregular menstrual period and muscle weakness, depression and mood swings. What is the treatment? Treatment of hypothyroidism include levothyroxine 1.6 microgram per kg of ideal body weight. Once you diagnose the case, it is lifelong therapy. So start with a smaller dose. And hypothyroidism has bradycardia. If you increase the dose suddenly, then heart failure may occur. Usually we start with 50 microgram for 10 days followed by 100 micrograms for 45 days. Increment in 12.5 or decrement in 12.5 microgram. Usually associated symptoms include vitamin B12 deficiency. Injection vitamin B12 is only effective. And prolactin, if it is high up to 60, we have to give levothyroxine. If it is more than 60, levothyroxine and cabergoline we have to give and monitor the lipid profile. Here, baseline is 25 or 50 microgram, and for 6 to 8 weeks, after 6 to 8 weeks, TSH, if you measure, if it is normal, there is no change in the dose. If it is less than 0.4, dose should be reduced And again, after 6 to 8 weeks, TSH is measured. If it is more than 4.6 micro milliunits per liter, dose is increased 25 to 50 microgram or 50 to 70 microgram. For 6 to 8 weeks, we have to monitor and TSH is measured. Treatment of hyperthyroidism. TSH is less than 0.4 with T3, T4 is high is hyperthyroidism. TSH is low with normal T3, it is milder subclinical hyperthyroidism. TSH is low with high T4, it is hyperthyroidism. What are the anti-thyroid drugs available? Carbimazole 5 to 40 milligram per day and methimazole 5 to 40 milligram per day, and propylthiouracil 50 to 100 milligrams. Usually it has palpitations and anxiety, so we will give propranolol 10 to 40 milligram for 6 to 9 months. Whenever we give anti-hyperthyroid drugs, we have to monitor CBC. There is a risk of agranulocytosis. Thank you.